All right, we're going to turn to healthcare topics, and joining me to do that is Dr. Kristen Sandel. She's the president of the Pennsylvania Medical Society. Doctor, welcome to the program.
Thank you for having me.
I'll tell you, this is something I never thought that we would be talking about on Pennsylvania Newsmakers. Emergency room overcrowding. That can be a very serious healthcare problem for folks, right?
Well, it certainly can. You know, our emergency departments are our safety net in the healthcare system.
Yeah.
And, you know, patients need a 24/7 option to seek care when they're ill or when they have an accident. And so the emergency department in most communities is the only place to provide that care.
Yeah. Yeah. And how overcrowded are they?
Significantly overcrowded. And it doesn't matter what part of the state you're in. It doesn't matter if you're in an urban setting or in a rural setting. Our emergency departments are overcrowded. There's a multitude of reasons for that, and the reasons actually vary depending on what type of community you're in.
What are a couple of the big ones?
Sure. So the biggest ones are staffing issues, especially our nursing staffing.
Yeah.
Also, the amount of beds that are available at specific hospitals. And then we have other issues like lack of access to care, either primary physicians, our substance abuse patients, or our behavioral health patients, which has becoming a significant amount of patients within the last few years, especially after the COVID crisis.
Yeah. I'll tell you, let's move on to another subject. Non-compete clauses in employment contracts. First of all, what's a non-compete clause in a contract?
Sure. So non-compete clauses essentially are designed to prevent patient migration from one practice or one system to another. So essentially, if you are a physician and you are employed by a practice or by a healthcare system, most of the time there is a clause that prevents you from working either in a radius, like a certain mile radius, 30 miles, 60 miles, or prevents you from working within a certain area. And so what we're seeing is the physicians, you know, are sometimes having to move out of their communities, move their families, and patients don't have access to them because they're not able to work in that area.
Yeah. Are there generally shortages with physicians? Yeah,
so you know, there is a physician shortage, and there's a shortage of healthcare availability to certain patients, and sometimes that varies depending again on urban or rural communities.
Yeah.
And so, you know, if there are only two options in the area in that limited access, you know, physicians have to move sometimes out of the state.
Yeah. Let's run to a break. When we come back, I want to talk about is there new legislation dealing with non-compete agreements? We'll get to that soon.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania American Water. We keep life flowing across the Keystone State.
All right, I'm chatting with the president of the Pennsylvania Medical Society. We're talking about health care. Before I get back to non-compete agreements, we were talking about emergency room overcrowding. What's being done about it? I don't think we got to that question.
That's a great question. The Pennsylvania Medical Society is currently having a task force that's trying to work on this issue. We've engaged a number of stakeholders, key stakeholders in the state, one being the Department of Health under Dr. Bogan, and also we've been having conversations with the Hospital Association of Pennsylvania, with the Emergency Medicine Association, Pennsylvania ACEP, and various other stakeholders to say, what can we do as a group collectively to try to
expand emergency room capacity?
That, and also where can we provide additional resources in the community to keep patients out of the hospital? And also, how do we train our healthcare professionals so that we have more healthcare professionals available, including nurses, nursing assistants, and other ancillary services, lab, radiology, and respiratory therapy?
All right, let's go back to these non-compete agreements. There is new Pennsylvania legislation. What is it, and what's it expected to do?
Sure. So House Bill 1633 is the current legislation, and what it's aiming to do is to help our employed physicians avoid non-compete contracts. And so there was a recent FTC ruling that would ban non-competes in for-profit systems, but that does not include the non-for-profit systems, which most of our hospitals are under non-for-profit status. And so the House bill would prevent non-compete clauses in the employed environment, whether it was for-profit or non-for-profit.
Yeah. So, and where is it in the legislature?
Right now, it passed the House, so it's moving to the Senate. You know, we also are looking at our small independent practices and saying, how can we help them as well? Because one of the issues in the past, which is why non-competes were put in, was because a small practice would hire a physician, train that physician, and then that physician would leave, open their own practice down the street, and take their patients. And so it was in position for a good reason.
So it's like a retail business.
Correct. But you know, as we've seen a lot of our physicians join big healthcare systems, that's not necessarily the case anymore. And so we're trying to protect our physicians and say, how can we protect our physicians as well as their patients to ensure that patient-doctor relationship stays in the forefront?
Now, on the national level, the Federal Trade Commission has also a new rule on the same subject, correct?
Correct,
What
yes.
is that rule?
Yeah, and so that rule is specifically for-profit. And that ruling was a 3-2 ruling recently. However, there is right now a suit that was brought by the U.S. Chamber of Commerce against that ruling because it does affect not only physicians but you know, employees of various different environments.
Yeah. So when we talk about these non-compete clauses, what does it mean to all of us who are patients?
Yeah, so I think the biggest thing is, you know, we want to keep physicians in our community, and we want to keep that patient-doctor relationship sacred. And so, you know, if you like your doctor, you've been through a healthcare crisis with them, say, you know, you had a type of cancer, or you have a rheumatology issue like lupus or rheumatoid arthritis, and you've been with that doctor for 20 years, and now that doctor feels that they're the best thing for them is to leave that practice environment.
They also retire, right?
Correct, yeah. And so if they're leaving that practice environment and moving to a new practice, we want to make sure that patient-doctor relationship is still available to the patients.
That's a great point. And it's also important as we seek out physicians, specialists, you know, where do we go? How do we pick one? What do we know about them? That's all. It all gets very complicated.
I think that's one of the things with medicine right now. I think patients are looking for continuity of care. You know, they want to see a doctor that they like and they trust, and they want to keep that relationship. And when you're, you know, when you're being transitioned from one place to another, you want to make sure that that information is available, that information about your care is right, you know, in front of the physician that's caring for you.
Yeah. All right. What other issues is the Pennsylvania Medical Society dealing with that folks should care about that would affect them?
Sure. You know, one of the bigger issues for us is scope of practice and ensuring that the physician stays the leader of the healthcare team. You know, we have been seeing more and more, you know, different healthcare providers like nurse practitioners and physician assistants, you know, lobbying for independence and independent care. And one of the things that we want to ensure is that, you know, we as physicians have, you know, 12 to 16,000 hours of training in our specialties. Yeah. And we want to ensure that patients are being cared for with the physician of that leader of that team. And I work with great you know, advanced practitioners, sure. and you know, a lot of them are very knowledgeable and very good at what they do. But we want to ensure that there are safeguards in place so that patients are cared for in a good quality and safety. Yeah,
that's a great point. And are there particular specialties that there are shortages in that folks should be aware of?
Yeah, so specifically primary care is always a challenge for patients seeking primary care. Primary care is the foundation of healthcare.
Sure, absolutely.
And and the primary care is really kind of the quarterback of the healthcare team. And we have a lot of specialists and consultants that that are available, and people obviously that work in the hospital, like myself as an emergency physician.
Yeah.
But primary care is really the people that do a lot of the work for patients, and they're the ones that we're lacking in certain communities, especially in our rural communities.
I'll tell you, before I let you go, you must see all kinds of people who are seriously injured because of accidents, automobile, truck accidents, correct?
Yeah, that's correct. And as we're getting into the summer months, motorcycles you may see, out in the road more often. And there are, obviously laws as far as, that, have more flexibility as far as helmets and other things. We don't have a helmet law in Pennsylvania, and you're allowed to ride without one. But, we would encourage people to be safe when they're on their motorcycles and wear helmets and wear the safety gear.
There are a lot of accidents with bicycles and
exactly.
things with fewer than four wheels.
Yeah, of course. Bicycles, we always recommend wearing a helmet. You can't replace a brain and you can't replace a head.
Yeah,
And so, it's very important to abide by the laws that are out there and ensure that, you're staying safe on the roads.
Yeah, that's extremely important, and driving is not the best.
That's for sure.
All right. Well, look, I want to thank you for coming on the program. This has been a very, very important update. All right. We will see you next week for another edition. No, we won't. We're on break. See you in a couple of weeks.